This section will focus on differential reinforcement. Differential reinforcement. Broadly, it is reinforcing appropriate behavior while withholding reinforcement for inappropriate or incorrect behavior. So, in differential reinforcement, you will reinforce appropriate behavior while ignoring the inappropriate behavior. Think of behavior like a muscle. You're going to work out the good behavior and ignore the bad. I want to take this time to say that if there's a behavior that has either a deficit or excess, remember an excess is that it's happening too much, or a deficit it's happening not enough. So if you have a behavior problem that has an excess, more than likely there's going to be a deficit as well. So let me give you an example. If a person is screaming too much, that's the excess, they probably have a deficit of asking appropriately. So the idea in differential reinforcement is that we're going to reinforce the good behavior, the desired behavior, and ignore the bad behavior. So in that example, the bad behavior, the screaming, the unwanted behavior, the excess behavior there, we're going to reinforce the good behavior, the talking or asking appropriately, while ignoring the screaming. In that way, we're going to be working on a behavior excess and a behavior deficit simultaneously. That's just something I've observed and learned over time. The point as an RBT in implementing differential reinforcement strategies is that you're going to be ignoring the inappropriate behavior and reinforcing the desired or appropriate behavior. I want to take this time to remind you that it's not just enough to ignore undesired behavior. We should also teach a good or desired or replacement behavior. Differential reinforcement generally is a behavior management strategy. It is also used in shaping. That's where we reinforce successive approximations. Here we're going to be discussing it as a behavior management strategy. So, if a patient is yelling because they want their toy, you will ignore the yelling, but honor the patient if they appropriately ask for it. We have to be careful not to prompt too much, especially if you find that you have to prompt each time. Why? Well, let's look at this. Let's look at this behavior. The patient wants a toy. The patient yells, you prompt, they get the toy. The issue here is that yelling always precedes your prompt. It becomes a piece of the chain for the patient to get their toy. So patient yells, patient sees toys, patient wants toy, they yell, you prompt, they get the toy. So essentially, you prompting them, although you're helping them, is getting in the way of asking appropriately. Why? Because it's part of the chain. If the patient wants a toy, from their perspective, patient wants toy, they yell, the person asks, oh, you want the toy? And you prompt them, and they get the toy. So either way, they're getting the toy, and the problem behavior is occurring. So this is why we don't want to over-prompt during this, especially if you find that you have to prompt each time. In differential reinforcement, typically you're going to ignore that problem behavior and wait for the desired behavior, or an approximation thereof. So in that previous example, we might do this. The patient sees toy, they yell, the RBT ignores or waits, the patient asks for toy, and the RBT provides toy. Eventually, over time, if we don't allow the yelling to pay off, they will start to go immediately to asking appropriately. Now, I want to reiterate, we don't want to overly prompt. But the analyst will help you with these kind of strategies, with what kind of prompts that would be appropriate. Typically, when we're working in differential reinforcement, for example, as an analyst, I won't use verbal prompts, so I might use, say, like a visual prompt, like a card or something, to remind him to use appropriate tone of voice. But again, that's going to depend on the situation. The point is that in differential reinforcement, we're going to ignore that problem behavior and wait for the desired behavior and reinforce that. And I want to stress, this doesn't work right away in most cases. It takes a learning history. It takes you a little bit of time to work up to. But as long as you're consistent and you don't allow that yelling to pay off, but you do allow the asking to pay off, they will eventually stop yelling, or the yelling will decrease, and they'll be asking appropriately. So here's an example of what may happen. The patient sees the water bottle next to a cup. Patient knocks cup over. And remember, you're differentially reinforcing, so you're going to ignore that. The RBT ignores. Patient picks cup up, knocks over again. RBT ignores. Patient then points at the water bottle. RBT says, "Awesome job, you asked for water." Picks up the cup and pours the water. Now eventually we would want to have the patient also have the cup upright before asking. But here the criteria was simply that they point or ask, not that they point or ask when the cup is upright. It's very important to understand that we need to honor the communication request of the appropriate behavior. So here in a DRA, we're reinforcing an alternative behavior. We are reinforcing an alternative behavior to knocking the cup over, to ask for water, which is either asking for the water or pointing at it. Another type of differential reinforcement is called DRI. This is differential reinforcement of an incompatible behavior. We're only going to reinforce behaviors that cannot occur at the same time as the problem behavior. For example, if we're looking at in-seat behavior, you cannot be seated and out of seat at the same time. So let's see how we would do that with DRI on a patient who enjoys attention. The problem behavior is out of seat. So we are there with the patient and they're in their seat. We praise them. "Hey, great job sitting." Patient starts to get out of their seat. We ignore that. Patient stays out of seat, so the RBT continues to ignore. Patient sits back down. The RBT praises. "Hey, awesome, great job, you're in your seat." In this way, we're reinforcing a behavior that is incompatible with the problem behavior. It cannot be done at the same time. DRO, differential reinforcement of other behavior. We're going to provide reinforcement if the problem behavior does not occur during some set time frame. If it does, we reset the timer. So let's say the target behavior is spitting, and let's say we set a time frame of 10 minutes. So again, I want to reiterate, a DRO is not just simply differential reinforcing other behavior every single time. There's a time frame involved. We provide reinforcement if the problem behavior does not occur during some set time frame. Why is this? Well, the best explanation I can give you is that let's say we were doing a DRO and it simply meant that, only reinforce other behavior. Well, what if the person's target is spitting, like we're saying here in this example, and they punch you? Well, that's another behavior, so you'd have to reinforce them, and we don't want to reinforce the bad behavior. We don't want to reinforce that behavior, so it does involve a time frame. Basically, it means if it doesn't occur during whatever the time frame is, we're going to reinforce. So again, I want to reiterate, differential reinforcement of other behavior is not just reinforcing other behavior, it involves time frame. So we provide reinforcement if the problem behavior does not occur during that time frame. If it does, we just reset the timer. So let's say the target behavior is spitting, and let's say we set that time frame to 10 minutes. Start of time, 10 minutes. At the 5-minute point, the patient spits. RBT ignores and resets the timer. At 7 minutes, the patient spits. RBT ignores, resets timer. This time, 10 minutes passes. The RBT reinforces the person with a favorite treat. So again, you have a time frame of 10 minutes. Each time the behavior occurs before that time frame, we have to reset that timer. So if this was a new skill versus something we were working on in a new way, we had just started, we might set that timer to lower. We might have to only set it for 2 minutes. Again, there's a lot of minutia in that. And as the analyst, behavior analyst, that's something I take into consideration. But for the RBT and for the purposes of this training, all I need you to do is to understand, as the RBT, what it is and how you'll be implementing it. It is not your job to decide that duration. It will be the job of the analyst, and it will be written down in the behavior plan in some systematic fashion. Finally, there's DRL. This is differential reinforcement of low rates of behavior. The aim is to reduce a behavior, but not totally get rid of it. Let's say excessive hand raising or excessive talking in a group. Hand raising or talking in a group, those are okay, those are fine behaviors, but if someone's doing it 100 times, it's a little excessive. So we set a criteria, the number must be lower than, and we reinforce if it meets that requirement. So let's say we want to reduce the number of times a patient mentions their favorite toy. Again, it's okay to talk about a favorite toy, but when they're doing it 100 times a day, people might get tired of it. So in this example, let's say the criteria is the person can talk about their favorite toy 10 times per hour. The individual can only talk about their favorite toy 10 times or less per hour. In the first hour, the patient talks about it 19 times. The RBT will provide no reinforcement because that was over the criteria. In the second hour, the patient talks about it 9 times. The RBT provides praise and a token for the class door. Why? Because they talked about the toy, the favorite toy, 10 times or less. In the third hour, the patient talks about it 11 times. The RBT will provide no reinforcement because it was over the criteria. They talked about it more than 10 times. In the fourth hour, the patient talks about it 7 times. RBT provides a token and some praise. Differential reinforcement is a great strategy for reducing behavior throughout. But those implementing it must be aware of the plan and when to ignore and when to reinforce and in what criteria. Again, differential reinforcement is primarily going to be a behavior reduction plan. We're going to be reducing the amount of a problematic behavior. It is a good strategy to use when behavior issues are prevalent in a case. Reinforce desired behavior, ignore the problematic. Over time, if that patient is mainly getting reinforced for their good behavior and the problem behavior is not being allowed to pay off, the good behavior will become more likely.